You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, a new treatment option for people suffering with gum disease. According to my first guest, he says nobody should have bleeding gums, loose teeth, bad breath. And we're talking about laser dentistry today. With us, we have America's periodontist, Dr. Joe Nemeth. Dr. Nemeth, welcome
Randy,
to the program.
So good to be here. I remember being here many years ago. It's so good to see you again.
Now, for people that don't know your practice, like who's the typical patient you see as a periodontist?
Well, we see two kinds of patients. We see patients who are about to lose their teeth, who can't save their teeth, because I like to save every tooth that can be saved. I'm where the buck stops. But there are situations where the teeth can't be saved. And in those situations, these people want to have something that they're going to be able to chew with and function with. And so we do dental implants for them if the teeth absolutely can't be saved.
I mean, you're a big center for dental implants there. Is that right?
We do a huge amount of dental implants, and we do a lot of something called all-on-4,
okay,
which is if somebody comes in with a denture or all of their teeth have to come out, we actually put 4 implants in, sometimes 5, and then we put a permanent set of teeth in immediately the same day. And that's in for 6 months or more. And then that is replaced by the second permanent set, which lasts a lifetime. These people love it. They have a beautiful set of teeth. They look great. They can function great.
They can eat whatever they want?
They can eat whatever they want. It changes their lives. It absolutely changes their lives.
How old can you be to get that done?
You can be 103. No, but you can actually,
really?
we've done it for people in their 90s.
Why
Absolutely.
would a 90-year-old want to do that?
Because they're alive, they feel good, they want to enjoy their food, they're still in pretty good health. Hey, why not?
Okay, now, gum disease. This is your
That's my
specialty.
bag. I love treating gum disease.
What is it, by the way? I mean, what are the symptoms and what is it?
First of all, gum disease is basically, very often there are no symptoms. Unfortunately, that's why most of my patients, or many of them, are referred by their dentist, because the patient doesn't know they've got a problem.
Okay.
The dentist finds the problem, and the patient didn't even know. Sometimes the patients come to me and they say, I don't know why I'm here. Well, I know why you're here, because you have gum disease and you're losing the bone around the teeth. So gum disease is a bacterial parasitic infection, starts usually under the gum, gradually destroys the bone. The teeth then become loose, may shift, may start getting bleeding, may start getting bad breath, and eventually, if it's not treated, these teeth have to be lost, which is why most people lose their teeth, not because of cavities.
So it's this bacterial infection?
Yeah, cavities you feel, you know you have pain.
Interesting.
Gum disease doesn't cause pain, so people don't know they have it. By the time they know, really, very often, those teeth have to be lost.
So you work together where you are with the general dentist. That means once this gum disease is out of control, is that when you get them?
I try to get it before it's out of control, but very often I get it when it's out of control. And many of these patients come to me and they've been to somebody and they say, well, they want to extract my teeth. They want to extract all my teeth, or they want to extract these teeth in the upper right, and I really don't want them out. And generally, in most of those cases, those teeth can be saved, and it can be saved with a minimally invasive great treatment, which I actually love and have been doing for many years.
Okay, so talking about lasers, I guess there's 2 ways to treat gum disease if you're a periodontist. One is with a cutting surgery, and one is with this laser.
Well, the traditional way, and the way that's probably still used primarily, is to actually open up the gum tissue. You make an incision with a scalpel, you open up the gum tissue, you clean out the infection, you cut
around the tooth, you're opening up the gums?
Yeah, you lift the gum back away from around the teeth, you open it up, you remove you scrape it out, you cut away any infected tissue, you trim the gum, and then you sew it back together again, and you let it heal, and you actually remove gum tissue in order to eliminate the pocket. So you've got a pocket, you cut the outside of the pocket away, then there's no pocket. The gum disease.
We're talking about a pocket around the tooth.
We're talking a pocket around the tooth that traps bacteria. Well, if you can reduce or eliminate the pocket by cutting it away, there's no place for these bacteria to lodge and hide, and very often it helps control or treat periodontal disease, and that's the way that traditionally gum disease has been treated, and probably for the most part is generally treated today, kind of unfortunately, I think.
So you don't like that way?
I would never do that way if I didn't have to. I'm not saying there are no situations where it's not necessary, but mostly this can be treated in a much less invasive way with using the laser.
So what's the laser way?
Well, gum disease is caused by bacteria under the gum in pockets around the teeth.
Okay.
And these pockets trap the bacteria get down there, they cause infection. The infection eats away the bone around the teeth until the teeth become so loose that they have to be extracted. There's no bone left.
Okay.
So with the laser, we go into the pocket with a very fine gold-tipped filament, and using the laser light, we kill these bacteria. We also cauterize or remove the lining of the gum pocket so that the gum can heal against the tooth and close the pocket by healing like a zipper, by healing against the tooth instead of cutting that gum away and eliminating the pocket.
And the teeth get strong again?
The teeth get healthy again. Sometimes if enough bone is lost, the teeth can't get quite as strong as they were because the bone doesn't always come back. But if we can save the teeth, if we can stop the bone loss by stopping the infection, then we can save the teeth and not have the mutilation or the removal of all that gum tissue that you have with the technique that used to be used and still is, and once in a while may be necessary.
For those people with the symptoms of bleeding gums, bad breath, loose teeth, after you go around their mouth with a laser, how soon do these symptoms go away?
The symptoms go away immediately. The symptoms go away immediately.
Really? Even the bad breath right away?
If the bad breath is caused by gum disease, and very often it is, the bad breath is gone. I had one guy, his mouth was really in bad shape, and his breath was such that I had to put orange oil, which is a strong oil, in the mask so I wasn't breathing his breath. It was really, really very, very bad, very strong. And in this individual, he was in his 40s. I won't say he was dating, but he was married, and his marriage was in trouble. His wife was complaining to me about his breath. Well, we treated his mouth, we got rid of the infection, the breath got better, and his personal life just got way better.
Because the bacteria that was in his mouth was causing the odor.
In his case, the bacteria in his mouth was causing the odor. Now, sometimes bad breath is caused by something else, but very often it's caused by gum disease. When I go shopping, I was in Canada not too long ago, and I went shopping, and in Canada, I could tell somebody had gum disease without even looking in their mouth. How could I tell? Because they had gum disease breath. I recognize gum disease breath. And it was particularly noticeable in Canada. I don't know why.
And that's an easy one to
places.
fix? Like for you in your office?
For me, it's easy to
fix?
fix because you get rid of the infection, you get rid of the bad breath that goes along with that infection. Absolutely.
Now in Canada, did you give them your business card or you didn't say anything?
Look, I didn't say anything. I didn't want to offend anybody, but people come to me all the time. They don't always know they have the bad breath. Okay. And they don't always have bad breath, but very often they do, and it goes along with that. As I said, there are other causes of bad breath, which we also treat differently, but very often it's caused by gum disease. I recognize it even before I look in the patient's mouth because I can just detect it.
What about when you're flossing and you get a little bit of blood? That's okay.
If you have a little bit of blood, it's not okay. It's never okay.
So if I'm bleeding a little bit, I'm
should
headed
never
for problems.
bleed. If you wash your face and it bleeds every time you wash it, is that okay? It's not okay.
Is that a fair comparison?
It's a fair comparison because gums only bleed if they're not healthy. They never bleed if they're as healthy as they should be. Never. And that's the goal that we aim to achieve when we treat gum disease with the laser. I tell the patients, you should have zero bleeding, no bleeding. Even when we clean your teeth and go under the gums, there should be zero, no bleeding ever.
Is that your goal? That means to catch these patients early on, like when it first starts to bleed? I mean, it makes it easier, less expensive?
Of course, the earlier you catch it, the better it is because there's less damage, there's less bone loss. So we always like to catch it early.
But you get them late. Don't you get late stage as a periodontist?
Listen, I get patients coming to me that have been to the dentist and they say, you know, they told me I have to have these teeth out and I just don't want to have them out. And I look at them and I say, you know, I don't think you have to have them out. I think we've got a really good shot at saving these teeth. And we generally do save the teeth. Now, once in a while, a tooth is so bad, we have to have it removed. In those cases, we do an implant. But I love to keep teeth. I love to save teeth. That's what I do. It's not only my job, it's my hobby, it's my vocation, but more than that, it's my avocation. I love it.
And we should mention, I mean, you lecture on this topic. You founded the North American Society of Periodontics, and you were one of the pioneers in treating gum disease with a laser. Is that right? Is that fair to say?
I was the first periodontist in Michigan to be trained and certified in using the laser to treat gum disease.
On your website, you have pictures or a button that says no cut, no sew when it comes to gum disease. What does that mean?
Well, typically, what you're talking about now, well, there's two different things. When we use the laser, we don't typically cut the gums, and typically we don't have to stitch the gums. So we don't cut, we don't sew, we use the laser to shrink the pocket and kill the bacteria, so we don't have to cut away the gum, and if you don't cut it away or open it up, you don't have to sew it. So that's what you're talking about there.
Yeah. Now, you say when a patient comes in with gum disease, bleeding gums, bad breath, loose teeth, you can show them the disease in their mouth. How?
Well, first we measure the gum pockets, how deep they are. Then we take a sample with a very small instrument from under their gum. It doesn't hurt, it's not painful at all.
Like a swab?
Well, you could call it a swab, but we actually go under the gum.
Okay.
And you could say we take a swab from under the gum, we put it under the microscope, and we look at it. We put it up to 1,000 power so we can see what's going on, and we can see whether there's parasites, whether there's bacteria. We can see the infection and the organisms that cause it, and we show that to the patient. We have a huge screen. It's about 70 inches wide and about 30 inches high.
And they can see the bad bugs that are living in their mouth?
They never forget it, Randy.
Really?
They never forget it.
So we have a slide, a video that you brought. And so you actually take a video of this?
We take a slide, we take a video of it, we put it up on a big screen,
okay,
and the patient can see exactly what's going on.
So what are we looking at here?
We're looking at a slide, and
wow,
mainly what you're seeing, there's a variety of bugs there, but the one that's most prominent is what's called spirochetes. They look like little corkscrews or worms.
They're like swimming.
They're like little spaghetti strings that are moving around. Yeah. And these are, you know, all of these things that are moving. If they're moving, they're bad, they're dangerous, they shouldn't be there. But these are particularly virulent or dangerous because they're finding these dental spirochetes, the dental ones, the ones in the mouth, they're finding these in the brains of Alzheimer's patients in much greater number than non-Alzheimer's patients. And they truly believe that this is a contributing factor to early onset dementia or Alzheimer's disease. That scares me, and it should scare everybody. Plus, there's a whole raft of other diseases that are related.
So when you go around the mouth with a laser, and they come back in 4 months and follow your at-home protocol, does the after shot, the bugs are gone?
It looks like a calm lake of nothingness.
Really?
Yeah, there's nothing there. If they're taking good care of their mouth, we've treated them with a laser, we've stopped the infection, they carry the ball from there, there's going to be like nothing to see.
So you show them the before and after?
Yeah, and many times we do. Actually, the key is bleeding. We know that if there's no bleeding, those bugs are gone. Because if there's bleeding, it's not healthy, the bugs are there. If there's no bleeding, it's healthy. So bleeding is a major sign of gum disease. But I'm talking about bleeding with flossing, bleeding even when they get their teeth cleaned in my office. There should be none of that.
Does this laser kill, because you said that some of these bad bugs live in the gums. Does the laser penetrate and kill some of those?
It kills them in the gums, it kills them out of the gums, it kills them very, very, very thoroughly. And it also removes the lining of the pocket so that gum can heal then once the infection is eliminated.
Now people need to know, I'm not trying to side with you on this, but logically, if you're saying that, and we've seen, if we go to that slide for a moment, all those bad bugs.
Yeah.
The way they normally get rid of those is they cut it out. Now, how could you get rid of, and these are microscopic, right? How do you cut those out?
Well, you don't.
Is that why it doesn't work the other way very well?
I'm not saying it doesn't work that way.
Not as effective?
It's effective, but it's disfiguring. It's cutting. It's the side effects are such that if you can avoid that, why wouldn't you? You cut away the gum. Well, if you cut away the gum, there's not going to be any place hopefully, for those bacteria and those parasites to lodge and breed and fester and cause infection. But in order to do that, you have to cut that gum away.
And the gums don't look good after that?
Very often, there are big spaces between the teeth. The teeth are sensitive. Food catches in these areas. Let's put it this way. It's not pleasant necessarily.
Is that right? Now, so this LANAP protocol that you use, that's the laser. Not all lasers are the same, because I guess there's multiple lasers.
Not all lasers are the same. We use, the Millennium laser is what we use. It's called the LANAP procedure, or the laser-assisted new attachment procedure, because it's a new attachment of the gum to the tooth using a laser to do that. And there's only one laser that's been approved by the FDA to do that, and also to enable bone. Actually, bone in many cases will regrow, and only one laser has submitted a 593-page research document to prove and show that it works, and that's the laser that we use.
So the older way, which is being done every day in your neighborhood and across Michigan, across the country.
Absolutely.
So the older way, when they cut it out, and they cut some of the gums, I guess they're left with kind of an unsightly look.
Sometimes.
But they don't get all the bacteria.
Well,
whereas the laser goes deeper. I don't want to put words in your mouth.
No, the laser goes deeper and kills the bacteria. This doesn't necessarily kill the bacteria. It eliminates the bacteria because it cuts all the gum away where the bacteria lodge and breed. Okay. So it does get rid of the bacteria. But then, because it's a little harder to maintain because the teeth are sensitive and food gets in there, even if it eliminates them temporarily, it may not be so easy to maintain it for the patient because of the sensitivity and the spaces that have been created for that the patient has to then clean. I've had people that have had it both ways. I've had people that have had traditional gum surgery on one side of their mouth, and it was really very unpleasant for them. They just really didn't want to go through that again. They wouldn't go through it again. And I saw them. We talked about the way we do it. It's less downtime, much less invasive, much kinder to the patient. We treated them, and it's like one world and another world, two different worlds, and the patients just, there was no comparison. It was a much more positive experience for the patient who would never go through the other again.
And how soon can they eat after the laser procedure?
As soon as they leave the office.
Okay.
They can eat immediately. Soft foods, yes, soft foods for a week. But they can have anything they want as long as it's not too hard to chew, and then after that they can eat whatever they want.
So what do you call, like in your business, periodontist, what do you call this surgery?
We call laser surgery. We call it laser surgery.
Okay, and the other one you call what?
Flap surgery.
Flap surgery.
Because you have a flap and you're opening up the gum and you're stitching it back and you're cutting it away.
Is one of your missions to, because you said something about your mission, would you say to kind of eliminate that old method and get more periodontists up to speed on this laser?
My mission is to help people get healthy and save their teeth. And my own feeling is that when this can be used, and I think it can be used a huge amount of the time, that's what should be used by everybody who's trying to save teeth.
Is this the future of dentistry? Whether it's 50 years or 100 years, that maybe the hygiene team on a lower level will go around the mouth and kill some of the bad bugs?
We use it in the office sometimes now for the hygiene team when they're coming in for periodontal checkups or maintenance. We will use a laser, a different laser, even at that time.
Do you get like the holistic crowd, like the Whole Foods people, they want to go natural with this type of procedure?
Yeah, I have the major holistic dentist, at least that I know of in my area. He refers his patients to me because he knows what I do. It goes along with his thinking, and it goes along with their thinking, because they just don't want to be, they don't want to be cut up, they don't want to have to be put on drugs or antibiotics if they don't have to be. They want it done minimally but effectively.
Now you mentioned antibiotics, because here in San Diego, everybody's afraid, the holistic crowd, afraid of antibiotics. Could you eliminate the gum disease without antibiotics, just using the laser?
We can eliminate it without antibiotics, just using the laser. Very often antibiotics are prescribed, but there are patients who don't want it, and we don't have to use it. But the patient does have that responsibility of making sure that they take care of their mouth after we've killed the bacteria, eliminated the infection. They still have to do their work afterward.
Okay, now I'm not an expert on this topic, but could we find a periodontist that could sit here and dispute what you're saying, or say, or poo-poo this laser and say, well, it just doesn't work?
Yeah, you're going to find a lot of periodontists that poo-poo this laser because they're not using it.
But is there research? I mean, published papers on this?
Absolutely. As I said, there was a 593-page research paper in March of 2016 that was submitted to the FDA proving that this is the only protocol where you can see true bone regeneration and true attachment to the root. I mean, I don't think there's no other protocol that I know of that has actually shown that, proven it, and gotten clearance from the FDA.
Now, we're short on time, but another thing that you do, and you're known for, one of the first guys in all of Michigan to do this, periodontist, and that is this procedure that eliminates gum recession and cold sensitivity. Tell me about that.
Yeah, patients come in and their teeth are long and their teeth are sensitive. Their teeth are unpleasant for them to look at, and they're maybe sensitive to cold. And it's called gum recession. So when your gum recedes, it moves away from the tooth. On the top, it moves up. On the bottom, it moves down. And the roots are very often sensitive. And also, sometimes it really, aesthetically, cosmetically, it doesn't look very good. More importantly, when the gum goes up, that means the gum goes up, the bone goes up also. So the gum goes up, the gum and the bone are attached. So if the gum goes away, the bone goes away. Same thing on the bottom. Gum goes down.
So you end up losing a tooth, possibly?
Very often, if that continues on, the tooth is lost because you lose the bone, you lose the tooth.
Okay.
Gotta have the tooth. Right. Gotta have the bone. Gotta have the bone. So here's how we would normally treat it in the old days. In the old days, and still in the new days, because it's still currently done, you cut gum out of the palate. You take that gum from the palate, the roof of the mouth, and you put it over the area where the gum is receded, and you cover the recession that way. But you can only do a few teeth, because how much gum can you cut out of the roof of the mouth? You can't cut out that much gum. So you can only do a few teeth at a time, number one. Number two, perhaps more importantly, it can be unpleasant. You cut gum out of the roof of the mouth, very often there's something called morbidity or discomfort or pain, or sometimes great pain associated with that. I've had patients come in, and they've had that procedure done on one part of their mouth, and they never ever want to go through it again. It was just too painful and unpleasant.
So like patching up that receding gum with gum from the roof of the mouth.
Basically,
and
yes.
And it's painful. Okay.
Basically, yes.
So what else are you able to do?
Well, we do something called the pinhole technique, which is minimally invasive. We make a small little pinhole under the recession on the bottom. We take small instruments and go through that pinhole, and we actually loosen the gum, and we loosen the gum enough so that we can just bring it up over the roots of the teeth. That's how loose we make the gum. And then we take material and we put it through this small pinhole in order to thicken the gum and hold it in place. And very often, no stitches are needed.
Okay.
It eliminates the sensitivity pretty much immediately. The cosmetics improve immediately, and the patient usually has little or no pain. That's the great part.
So on the upper teeth, okay, so the gums haven't disappeared, they've just kind of rolled up?
Exactly.
Okay, and you're able to pull them down.
Yes.
And with this new technique, they stay down.
Yes.
I mean, logically, it makes, why aren't they all doing it this way?
They will be.
Oh, is that right?
I think they will be.
So as a periodontist, so across Michigan, every single day, there's dentists busy taking grafts from the roof of the mouth and patching it.
I have patients coming to me very frequently who have had that procedure done. And even that procedure isn't even working sometimes. Sometimes the gum has continued to recede despite the fact that they did it that way, which was considered the gold standard. I never do that way anymore. So to me...
So you just pull the gums down if it's on the upper.
We release the gums. Okay. So that they're so loose that they can be pulled down, or they actually sort of come down naturally. Then we put a material underneath that to thicken it and hold it in place, and done. That's it. And it stays that way. And we teach the patient how to take care of their mouth after that, so that we don't want it to come back again, and it won't. So
do they come in more for the cold sensitivity or the aesthetics, the way it looks? They don't like the way it looks.
Both.
Okay.
I would say they come in for both. And some of them, once in a while, don't even have symptoms. Their dentist says, you better get to see, you gotta get this taken care of, because your gums are receding. They're going down or they're going up. If you keep losing the gum, you're gonna lose the bone. If you lose the bone, you lose the tooth.
You lose the tooth. Okay. Yeah, but isn't it okay, like for example, a general dentist, if they have showing a lot of gum, can't they just put like tooth filling material over that?
Yes, absolutely, and that's what they usually do, but it doesn't stop the recession. The recession will, in all likelihood,
Okay.
the gum recession will continue. The filling puts a filling, but it doesn't stop the gum recession at all. Very often it doesn't
you don't
stop
like
the
that?
sensitivity. I wouldn't do it because I know a better way. I don't like to condemn anybody for what they're doing because for them it's working. But for me, I think I know a better way.
Dr. Nemeth, we are completely out of time. Okay, final message. We talked about two things. People with bleeding gums, bad breath, loose teeth, with gum disease. They've been told
Right.
they're going to lose a tooth.
Right.
Maybe they've never heard of this laser.
Right.
And they're skeptical, though, even
Right.
though they heard what you say. Or the other group of people with severe receding gums.
Or not severe, just receding gums.
Just receding gums.
Yeah.
And they heard about this new pinhole technique.
Absolutely.
But for whatever reason, they're still hesitant. What do you say to them?
I say it's minimally invasive. You're not going to have pain. Let us take a look. We'll inform you completely. Then you can make some decisions.
So, we haven't mentioned, but most of these people are numbed and sedated during the procedure. Is that right?
They're always, almost all sedated and numbed. Most of my patients, we ask them, do you have a fear of dentistry? Yes. Don't worry. You're going to be asleep. You'll wake up. It's done.
Okay, it's that simple.
Yeah.
Final message. We're out of time. We've talked about receding gums and this new technique without surgery or without the traditional surgery.
Yeah.
And then we talked about people with bleeding gums and bad breath and loose teeth using a laser to kill the bad bugs. But let's say they heard what you had to say, but they're still afraid or still skeptical. What's your advice?
Get into the office. We'll give you a consultation and let you know what's going on. You can make some decisions, and I think you'll be surprised at what you see and what we tell you.
Thanks for coming on the program. Very, very good.
My
Very interesting.
pleasure.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.